Good day, everyone. I am John Lawrence Botol, and today we're going to have a continuation of our topic, and this will be our last topic, and it is about the learners with difficulty in walking and moving. So, before we proceed to the discussions, let's have read the learning outcomes of our topic, which is define physical disability. Discuss the characteristics of a learner with difficulty in walking and moving along with their challenges in learning. Differentiate types and causes of physical disabilities. Discuss accommodation, environmental modifications, and assistive technology. Analyze the importance of accommodations and assistive technology to learners with difficulty in walking and moving. And lastly, apply appropriate interventions and adaptive supports for learners with difficulty in moving and walking. So, physical disability. So, what is physical disability? So, from the word itself, physical disability, it is a long term or loss or impairment of parts of a person's body function. So, resulting in a limitations of physical functioning, mobility, dexterity, or stamina. So due to the functional loss, the person will experience the inability to perform normal movements of the body such as walking and mobility, sitting and standing, use of hands and arms, muscles control, and etc. So the impairment may range from mild to severe, may have minimal impact on the student or interfere substantially with functional ability. Some may appear entirely normal, others have a highly visible disabilities. So a person can be physically disabled due to two reasons. So there are two reasons, which is the first is congenital or hereditary. So mo siyang kanang makuha sa genes. So the person have physical disability since birth or the disability develop at a later stage due to the genetic problems with muscle cells or injury during birth. So second is acquired. The person acquired a physical disability through road or industrial accidents, infections such as polio or diseases, and disorder. So what are the characteristics of a physical disability? So physical and mobility impairments characteristics may include persons with physical and mobility impairments experience deficits in motor and or fine motor functioning, locomotor and non-locomotor functioning. So there is the potential for deficits in cognitive, social, and adaptive behavior skills as well as impairments in language, vision, hearing, or other sensory areas. So persons with physical and mobility impairments may experience stiffness or spasticity as well as loss of muscle strength. So they may need help with learning or activities of daily living. So persons with physical and mobility impairments may need assistance with mobility transfer and ambulation. So they may have also a limited range of motion and be reluctant to attempt movement or experience and perceptual and cognitive impairment. So they may experience pain, discomfort, depression, anxiety. So persons with these impairments may require prolonged bed rest and have medical restrictions. They may have musculoskeletal or neuromuscular impairments as well, which is be discussed later on. So it impedes speech production and the expressive language. So as what you observe in the characteristics of this physical disability, madamay gid halos tanan ang iyang aspects no sa person, which is maapektuhan ang iyang cognitive, social, adaptive behavior skills, maapil sad ang about sa language, vision, hearing, and other sensory areas. So proceed ta sa atohang katong two types and causes of these physical disabilities, which is naatay gitawag siya neurological impairments ang una. So these are the group of disorders that primarily relate to the central nervous system, comprised of the brain, spinal cord. So a neurological impairment or disability may affect an individual's speech, motor skills, vision, memory, muscles, action, and learning disabilities. So, causes of neurological impairments. So, muna siya ang causes of neurological impairments. So, you can pause the video if you want to take note. So, first, infectious disease, hypoxia, poisoning, congenital trauma, jaundice or jaundice. So, RH, incompatibility. So, smoking. Pill po na siya, ka-affect. So, types and causes. So, natay cerebral palsy. So, what is cerebral palsy? So, it is not a disease. It is a condition characterized by a paralysis, weakness in coordination, and or other motor dysfunctioning because of the damage to the brain. So, dili na siya disease. So, condition, I mean, causes ani siya nga nang having siya, ning ani siya, na cerebral palsy. So, damage to the parts of the brain which is control movement during the early stage of the development. So, most cases, this damage occurs during pregnancy. However, damage can sometimes occur during birth and from brain injuries in early infancy, such as lack of oxygen from near drowning, meningitis and head injury or being shaken. Then, classification of cerebral palsy according to the extremities involved. So, na siya'y unom ka classification of cerebral palsy. Ang first, which is quadriplegia. So, quadruple. So, involvement of 4 limbs. Then, diplegia, involvement of 4 limbs with legs more affected than the arms. So, paraplegia, involvement of the legs lang. Then, triplegia, so triple. So, 3 limbs. So, hemiplegia, one side of the body is affected. Then, mono, which is isa lang, monoplegia, one limb is affected. So, these are the types of cerebral palsy. Spastic atetosis, rigidity, tacit, tremor. So, these are the muscle stiffness or spasticity ang first, which is the child who is spastic has muscle stiffness. Second is the uncontrolled movement or atelectasis. These are slow, wriggly, or sudden quick movements of the child's feet, arms, hand, or face muscles. So, poor balance or ataxia, siya ikatulo. The child who has ataxia or poor balance has difficulty in beginning to sit and stand, fall often, and have a very clumsy use of hands. Then, the last one is mix. So, ano to siya, sagol na sila or more than 2 have cerebral palsy. Some people have more than one type of cerebral palsy. So, proceed. So, ikaduha is seizure disorder. So, it's a sudden alteration of consciousness, usually accompanied by motor activity and or sensory phenomena. So, makita nato ni siya sa screen na one of the best example ni siya kay kanang epilepsy, which is common kayo na sakit. So, types of seizures. The International League Against Epilepsy suggests 2 major types of seizures. So, na generalized and partial. Then, sa other terminologies, na siya tonic or clonic. So, in generalized involves the discharge of cells in a large part of the brain. The partial begins in localized area and only a small part of the brain is involved. So, for the other terminologies, so tonic and clonic, the person loses consciousness, becomes rigid due to the strong muscle contractions, or muna siya ang tonic stage, then begins to jerk rapidly or shake. Then mo to siya ang clonic stage. Then for the absence, brief generalized seizures manifested by the brief absence or lapse of consciousness lasting up to 30 seconds. So, napa siya ang iyahang ubang sa ikatulo which is the spina bifida. So, it is a birth defect that occurs when the spine and spinal cord don't form properly. So, unsay cause ani niya, the type and amount of disability caused by spina bifida will depend upon the level of abnormality of the spinal cord. Children with spina bifida may have partial or full paralysis of the legs, difficulties with bowel and bladder control. So, mo na siya ang result. So, magkaning-ani mo. Magkaning-ani ang person rather. So, ikaduha na ta na types which is kadto siya ang una belong to siya sa neurological disorder which is one of the types and causes of having physical disabilities. Neurological impairments ang first. Then now let's proceed to the musculoskeletal conditions. So what is musculoskeletal conditions? So it involves the muscles or components of the skeletal system na budta. Kung ganina nervous system, karon na pod ang skeletal system. So this includes the muscle themselves, the tendons and ligaments and other soft tissues such as the bursa, sacs of fluid that help in the lubrication of the joints. So muscular dystrophy, so weakening and wasting away of muscular tissue. So naa siya 3 ka characteristics. Ang una ay 3 ka types which is the atrophy, the degeneration of tissue such as muscles or nerves. Second is myopathy, a weakening and wasting away of muscle tissue in which there is no evidence of neurological disease or impairment. So dystrophy, hereditary, progressive, weakening and wasting away of muscle tissue in which there is no evidence of neurological disease. Arthritis, a disease involving inflammation of the joints. So, arthritis, common ganito sa mga tigulang, no? Kanang hina na kay tuhod. So, first, nasa duha ka types. Rheumatoid arthritis, a systematic disease with major symptoms involving the muscles and joints. Then, second is osteoarthritis, a type of arthritis common among children with disabilities in which movement is painful or impossible because of damage to the cartilage around the joint. So, nadiri siya ang club foot, one or both feet turn at the wrong angle at the ankle. Scoliosis, abnormal curvature of the spine. Osteomyelitis, bacterial infection of the bones. So, leg calf, Pettis disease, flattening of the femur or hip bone. Then arthrogryposis, muscles of the limbs, missing or smaller and weaker than the normal. And lastly, it is the osteogenesis imperfecta, also known as the brittle bone disease, and is a group of genetic disorder that mainly affect the bones. Katulo is the congenital malformations. So, common malformations is congenital malformations of the heart and or blood vessels. Congenital dislocation of the hip, malformation of the extremities, and malformation of the head and face. So, what is the cause niya? Teratogens, deformity, producing factors that interfere with normal fetal development. German measles or rubella, a serious viral disease which it occurs during the first trimester of pregnancy, is likely to cause a deformity in the fetus. So, congenital man siya. So, magpasabot ang congenital, makakuha mo siya about sa genes niya sa imong during pregnancy. Then, causes for phocomelia, a deformity in which one of the causes is phocomelia, a deformity in which the limbs of the baby are very short or missing completely. The hands, the feet attached directly to the torso. like flippers. Many cases resulted from maternal use of the drug thalidomide during pregnancy. And lastly, the fetal alcohol syndrome. Abnormalities associated with the mother's alcohol during pregnancy. Defects range from mild to severe, including growth retardation, brain damage, mental retardation, hyperactivity, anomalies of the face, and the heart failure. So, mo po na siya ang mga causes po na magkaning surgical malformations. Kanang ilig kay inom alcoholic during pregnancy. So in this slide, you see continuation, and Rafi Pabilar, you may proceed now.
So, good day. I am Rafi M. Pabilar to continue our topic. So, what is accommodation? It is a change that helps students to overcome or work around the disability. The student is still expected to know the same material and answer the same question as fully as the other students, but he doesn't have to write his answer to show that he knows the information. So, accommodation, it is how we assess or how we accommodate a person with disability in order to become more comfortable and getting learnings like other students that have normal or have without disability. So in providing accommodations for students with physical activities, we need to remember that some conditions are characterized by periods of remissions, so the disability will not always be visible and will not always impact the student's ability to function in the educational environment in the same way. Each learner with a physical disability should be assessed individually, and accommodations should be implemented based on the unique needs of students. So every students that have physical activities there is a unique physical activities in students. Also, they have a unique process or accommodation for them in order to be more comfortable in our school environment. So next, in order for the students to assess the general curriculum, the students may require these accommodations. So here is the accommodations that we need to implement in order to a student can be learn in a school environment. So first is visual setting arrangement to develop useful posture and movements. Second is instruction focused on development of gross and fine motor skills. Third is securing suitable augmentative communication and other assistive devices. And last is awareness of medical condition in effect on the student, such as getting tired quickly. So we also considered those disabilities for them with their weakness or disadvantages. And for example, they are getting tired quickly, so we need a time duration that is fit or fixed time duration for them in order to learn for our lesson. So next is due to the multi-faceted nature of orthopedic impairments, other specialists may be involved in developing and implementing an appropriate educational program for the students. These specialists can include, first, physical therapists who work on gross motor skills that focusing on the legs, back, neck, and torso. Second is occupational therapists who work on fine motor skills that is focusing on the arms, hands, as well as daily living activities such as dressing and bathing. Third is speech-language pathologists who work with the students on problems with speech and language. And next is adult physical education teachers who are specially trained PE teachers who work along with the OT and PT to develop an exercise program to help students with disabilities. And lastly is other therapists that can make massage therapies, music therapies, and etc. So next slide. Next slide. We are here. Common characteristics of the students with physical disabilities and commonly suggested accommodations, classroom adaptations. So for the students that has needs specialized transportation, the suggested accommodation for them is to create a physically accessible environment that is not mobility limited. Second is be flexible with the schedule. Students may arrive late or have to leave before the class is overdue to adapt transportation services. And second, students is often physically unable to hold a pen and write for extended periods of time or may experience challenges with input, output, and information processing when working on assignments, tests, and or exams. So the suggested accommodation for them is to replace written exam or assignment with an oral exam or presentations. Use of note takers, use of assistive technology such as computer, assistive software, mini recorder, and other more. And also use a scribe or speech-to-text software to record answers on tests and exams. And last, provide a room other than the classroom for exam if required. Then third, student has difficulty finishing assignments and or tests in allotted time. There will be suggested 2 extra time for test, exam, perhaps some components of coursework. And we are here for students experiencing fatigue and limited mobility when speaking to a person for a long period of time. And we also suggested accommodation is when speaking to a person who uses a wheelchair for a long period of time, avoid the need for them to strain in order to look up at you by sitting beside or leaning towards them during the conversations in order for them to avoid experiencing fatigue and or pain, or requires extra time to obtain formats compatible with assistive technology. So what is assistive technology? We can see in the next slide. What is environmental modification? Environmental modification are frequently necessary to enable a student with physical disability to participate more fully in the classroom activities and independently in the school. So this may involve workspace modification, changes in the location of materials and equipment, object modifications, or adapting equipment or materials for given tasks, changing the manner in which the task is done, and use of manipulation aids. So, within the classroom, the problem to the students with physical disabilities may be solved by simple procedures that require little or no cost at all, like the following. So, number 1 is modifying school furnitures by changing the desks and tables, tops to appropriate heights for students who are very short or who use wheelchairs. Adjusting seats to turn to either side so that the child with braces can sit more easily, providing footrest, adding height extensions to desks with a cut-off for the child who has poor sitting balance, eliminating protruding parts over which the child might trip. And next slide. Number 2, providing need based on assistance like taping paper to the desk, devising some means of keeping pencils, crayons, and other material from rolling on the floor, providing backtracks or mechanical page turners, providing wooden pointer to indicate the response on the board, installing paper cup dispenser near water fountains for wheelchair users, and placing rubber mats over the slippery section of the floor. So, next slide is what is assist device or technology. So, it is defined an idea as a any term, piece of equipment or product system, whether acquired commercially, off-the-shelf, modified or customized, that is used to increase, maintain, or improve functional capabilities of a child with a disability. So individuals with physical disabilities use both low-tech assistive devices such as adapted eating utensils, picture communication books, and high-tech assistive devices such as computerized synthetic speech devices, electronic switches that can be activated by eye movements for a wide variety of purposes including mobility, performing daily life skills, improve environmental and manipulation and control, better communication, access to computers, creation, and leisures and enhanced learning. So, what is mobility aids? So, mobility aids are assistive technology devices that help people to perform movements in a variety of environments. These include manual and electric wheelchair, canes, scooters, walkers, vans, modified for travel, electronic direction finding mobility aids, and other adoption and devices. So number 2, what is sitting and positioning? Are used to position the disabled person as the best posture to participate in a particular activity. The activity might involve moving from place to place, sitting during conversation, eating, sleeping, and others. Third is what is aids for daily living are devices. It is used to increase independence. They assess an individual in performing functional living skills or self-help activities such as cooking, eating, bathing, toileting, dressing, and home maintenance. So to sum up, making the adjustment to life with limited mobility or motor control can be a difficult process, as they experience success in the classroom, motivation and learning increase, and overall students' outcomes improve. There are many disability support services available to help them to maintain their independence and live well in the community. So that's all for our report. Thank you for listening. Once again, I am Rafi M. Pabilar, and together with my partner, John Lawrence Ibutal, we are all thank you for all, and mabuhay. God bless us all.